Millions of elderly Americans live in nursing facilities, but through oversight and enforcement work, OIG has found some alarming problems. Coming to you via video conference from Kansas City is Brian Whitley, Regional Inspector General.
We've seen appalling instances of patient abuse and neglect in nursing homes through OIG's investigations and those led by our state Medicaid enforcement partners. When we investigate cases of abuse or neglect in nursing homes, there's typically one of three things that we'll find. One, either a lack of staffing, adequate staffing and trained staff and supplies in a nursing home. Two, overmedication of the residents. Or three, individual bad actors, so a certified nursing assistant or other personnel that may have had a criminal history that somehow got through the system and is taking care of residents in these nursing homes. In one example, a nursing home persistently overmedicated its residents, and this led to falls and fractures for some of those residents, and even there were a couple of premature deaths that were a result of this overmedication.
In 2016, state Medicaid fraud control units reported more than 1,000 open abuse or neglect investigations in nursing and assisted living facilities. Our work identifies the prevalence of certain problems and risks, as well as safeguards to help prevent problems.
The scope of this problem is pretty large. In one recent OIG study, we found that 85% of nursing homes reported at least one allegation of abuse or neglect to OIG during a one-year time frame.
OIG uses all of its tools to combat nursing home abuse, neglect, and failures of care. These include investigations, program exclusions, corporate integrity agreements, and recommendations to the Medicare and Medicaid programs for better patient protections.
So depending on the case, OIG might work with the Department of Justice to secure criminal convictions or to resolve civil fraud allegations. The OIG also has certain authorities, and in another case, OIG used that authority to exclude a nursing home and its owner from participating in any federal health care program for 30 years based on patient neglect and failure of care. We also seek to prevent patient harm from occurring in the first place. For example, use of antipsychotic drugs in nursing homes fell by 30% after the Centers for Medicare and Medicaid Services implemented OIG's recommendations to reduce overmedication. OIG will continue to root out fraud, hold wrongdoers accountable, and recommend solutions to better protect patients in nursing homes.